We've talked about this before, but I think it needs, particularly this week, I think it needs stating again. All the restrictions are putting pressure on people all throughout the spectrum. You know, mums and dads with kids at school, people who haven't got work or have got less hours, businesses who are trying to get back on their feet. But I'm focused on those who are, and their families, at the end of their life during this COVID pandemic. And we know to get around, to get into borders, to see someone you love who's dying, if you're the person dying, to have those you love around you, it requires travel permits from the Chief Health Officer. That's just another hoop they have to get through. And it's really affecting, you know, people right across the country. I spoke a little while ago, Breast Cancer Network Australia were on the show, and they are saying more families are being forced to care for their dying relatives at home. At home. They're worried about them going into hospital, in palliative care, because of all the COVID restrictions, to be able to be with them at end of life. The CEO of Breast Cancer Network Australia, Kirsten Pilatti, joins me now from Melbourne. Kirsten, I'm really pleased to have you back on. I don't want to ever pick up an issue as important as this and fall away from the focus. You reached out to me to say that after we spoke and we were trying to, you know, expose how tough it is, and there was a tragic case of a dad trying to look after two kids at home, and his wife was at end of life with breast cancer, and he was battling by himself. It hasn't really got better, has it?
No, Peter, sadly it hasn't. And in fact, it's become more complex in many ways. Common sense is definitely not prevailing here. And it's interesting you say here in Victoria, families have now been asked if they want to spend time together, they need to get information or a clearance from the Chief Health Officer. But we're not even sure how to do that. And so families who are finding it already difficult to navigate a system are just being held up with bureaucracy that is just unimaginable right now. And, you know, it's happening here in Victoria. We've got families in South Australia who are repeatedly asking the West Australian government to go home and being rejected. I mean, it is just ridiculous how difficult families are needing to spend time on things that they don't want to right now.
And time is precious. Time is all they have, and it's a diminishing resource when you're in palliative care. And to be honest, you know, COVID is the least of their worries, least of these families' worries. Are you talking about just people trying to move across borders, or are you talking about the circumstance we had on the show where Dad was at home and he's got young children, was worried about going into hospital because they had said to him 2 visitors a day and only for this amount of time, and you can't touch the patient and all of the usual rules. And he said, my wife doesn't want to die like that, and the kids and I don't want her to die like that. So what are we talking about?
There's so many things we're talking about, because people don't want to break the rules, but they're being forced to. So we've got families where there are multiple issues of the families not wanting for their children to break the rules of the more than 5Ks. So people stuck in regional areas trying to get to Metro Melbourne to say goodbye to their loved ones. People not going into hospital because they don't want to be isolated, but yet their pain management is really important right now. And we absolutely know that the health professionals in community palliative care are stretched, and we need urgent funding to increase their capacity to help people to stay home. We need rules that are compassionate, and really, there is an inquiry happening into the impact of palliative care into COVID-19, of which, of course, we are contributing to, but we don't need an inquiry right now, because every hour, every minute matters. And, we are taking away precious time from those families where they can be having conversations that will last them forever and to help them to have amazing memories.
I know I'm getting teary even listening to you. What's your consultation been like with government? Like, where are you up to? Why can't they streamline this? Why can't they put the trust in people that they're not going to do the wrong thing here? They've got no interest in doing the wrong thing. They've got bigger fish to fry. What's your conversations been with the Chief Health Officer in Victoria, for example? What have they been like?
So the Chief Health Officer has given guidance to the hospitals, and I have to say his guidance are excellent, and they tell people to allow people into hospitals. But depending on which nurse you get, which ward you get, every hospital is taking those guidelines and making their own rules. You know, we had an example in Echuca where a family in the media this week were left outside in the cold because one nurse decided that only one family member could be in the room at a time. And in fact, the family missed out on saying goodbye to their family member. I mean, we just need people to have common sense. The guidelines have been given. Let families come together. And as well, we really do need that investment in community palliative care immediately. And I know that the Victorian government have increased and said in their cancer plan that they'll increase palliative care funding. We need that now. We need it today, not in a couple of years once we've heard the inquiry.
How much, sorry to interrupt, how much money are we talking about? How much money have you put in the submission that you want to see?
Well, I think we haven't put in a funding amount of money, but we definitely know that health professionals are seeing double the caseload that they're funded for. But that means that health professionals are doing it in their own time. It's extraordinary what these health professionals are doing at a local level, and they must be supported.
Do you know how much the budget for palliative care is in Victoria? Have you got any sense of the scale of that budget?
Not at the moment. So, but I think that's what the inquiry is really looking at. And I would say we'd be needing at least a doubling of the community palliative care to be able to deal with the future of people wanting to die at home as well.
I tell you what, I will go and do some homework on this myself, and I know exactly who to ask. I'll be asking all of these questions for you. It's got to be fixed. It's got to be fixed. You know, if they can find $30 million for a dodgy security firm in 6 hours flat, they can find money for palliative care for people to die with dignity at home. Kirsten, you're amazing.
And I also want to say
to you.
Thank you, Peta, but I do want to give a practical solution for families who are trying to navigate this system.
Yes, please do that, please.
To call the Cancer Council helpline on 13 11 20 or BCNA if it's breast or canteen, because we will help you try and navigate this system. We know it's difficult, but we will be there for you every step of the way.
Kirsten Pilatti, you're amazing. I'll put all of that up on my Facebook page, but thank you very much for being with us tonight.
Thanks, Peta. You're a champion.